Welcome to Industry Viewpoints, brought to you by the American Bankruptcy Institute. Each segment will feature experts providing views on the current state of a particular industry with focus on what lies ahead. My guests on this edition are Suzanne Koenig and Nancy Peterman. Susie and Nancy are the chairs of ABI's healthcare program to take place on October 25 and October 26 in Nashville, Tennessee. The program will be both virtual and in person. Susie is the president and founder of SAK Management Services in Riverwood, Illinois. SAK is a boutique healthcare advisory firm. Nancy Peterman is a partner in the Chicago office of Greenberg, Traurig, where she focuses on healthcare restructuring. Today, we will be talking with Nancy and Susie about conditions in the healthcare industry, present and future. All that having been said, let's now turn to the topic of healthcare. Where are we now? And where will we be, say, a year from now? For starters, I have to admit that when the pandemic started, I was, of course, aware of how tenuous the financial condition was in many hospitals, especially community hospitals around the country, and for that matter, nursing homes, skilled nursing facilities as well. And I was panicked because I was afraid that just as we were going to be slammed with hundreds of thousands of hospitalizations for COVID, that the hospital's financial resources would be depleted and the industry would collapse just when we needed the industry the most. So tell me, folks, did that happen?
Well, I think, thank God it didn't happen. And I will tell you, you weren't the only one that was afraid. All of us who provide healthcare, we were panicked too. I don't think there was anyone out there. I think the government was panicked. I think everyone was panicked. I don't think there was one person out there that said, yeah, I got that. So I will tell you, thank goodness that everyone, all of the healthcare providers, the hospitals, the nursing homes, the home healthcare companies, everyone, they did everything they could to come up. And I will tell you, we had a lot of heroes, and that was everyone in this industry. And thank goodness at the time, the government was a terrific partner and did everything they could to provide stimulus funding and to waive policies and procedures and things of that nature to be able to allow us to be successful and not fold.
Well, Susie,
many healthcare companies.
Susie, let me ask you this to get a little bit granular about it. It sounds as though you're saying the government rode to the rescue. Could you tell us a few of the policies or procedures that the government implemented that allowed the healthcare industry to keep its head above water?
Sure. I operate skilled nursing facilities, and usually there are pretty stiff Medicare requirements for patients leaving the hospital to come live in a skilled nursing facility. There must be a 3-day hospital stay, 3 midnights in the hospital. The government waived, that was one of the waivers that allowed patients to come right into the nursing home if they needed them, because there were so many patients that couldn't get care in their home. Not only that, but they were also able to come straight to the nursing home without even going to the hospitals, which was a huge benefit for patients to get through the system and to get the care they needed.
Well, tell me this, did the government do anything to, shall we say, accelerate the cash flow of medical institutions?
They accelerated it certainly by giving stimulus payments, were so helpful. Most healthcare facilities, hospitals who were on the brink, literally pre-pandemic, were able to survive because stimulus payments were coming immediately. Again, without.
And I was just say when you say immediately, like deposited in the bank account, there weren't forms being filled out really immediately at the start of the pandemic. The Department of Health and Human Services, it was called Operation Warp Speed, and they got money into the bank accounts of all of the key critical healthcare facilities around the country, because with COVID and the pandemic, we were all afraid, but imagine if our healthcare system had collapsed, how much worse this all would have been over the past couple of years.
Yeah, and as Nancy said, we got money in our bank accounts and we said, what's that for? I mean, literally, it was so appreciative and so well done.
Well, you know, before COVID, we were up to our eyeballs in healthcare bankruptcies and restructurings. But am I correct that that has subsided substantially as a result, or not a result, but alongside the pandemic?
Yeah, I think it is. I'm going to say as a result of the stimulus funds that we talked about. The stimulus funds that the government provided have really propped up the healthcare industry. I was involved in a case on the West Coast where, there was a group of skilled nursing facilities. They ultimately didn't even need a debtor in possession loan. Once the pandemic hit, their cash flow improved dramatically. And it actually changed the entire outcome of the case, where it looked like creditors would get paid next to nothing to creditors ended up getting paid in full. Because there was such a turnaround in the revenue of that facility.
Well, let me ask you this. Let's talk about the level of funding. Was the level of funding for COVID patients from the government higher or lower than for, let's call them, non-COVID patients?
So in skilled nursing facilities, the majority of patients are usually considered to be Medicaid patients, which are financially need and not necessarily clinically needed. I mean, you need both. But when COVID residents, when a resident was diagnosed with COVID, their reimbursement status immediately changed to Medicare, which is the preferred, which is more money than what all of the other payers are. So skilled nursing facilities, if they open COVID units, and many of them had to do it by they didn't have their choice. They had to, because, there were many of the facilities got hit. And as a result, their reimbursements literally doubled than what they were pre-pandemic.
Yeah, and I was say, Susie, I think it's accurate to say that the skilled nursing facility census went way down when COVID hit, because no one wanted to put a loved one into a skilled nursing facility. They wouldn't be able to visit them. And so, as you said, the skilled nursing facilities were almost forced, but it was a necessity to take in these COVID patients, necessity to support the healthcare system, and then a necessity to build up census and increase revenue.
Yeah, national occupancies went from the high 80s to the very low 70s, and even lower in many facilities. And until the states opened, which is still, in the past few months, census levels have increased a little bit, but we're certainly not back to pre-pandemic levels. People still are afraid.
Well, let me divide the healthcare industry into three baskets. The big hospitals, or the academic hospitals, community hospitals, and nursing homes. Among those three, which were most dependent upon government assistance to keep their heads above water?
I think all of them were dependent. There was not one that wasn't. Your small rural hospitals many of them were on the brink anyway. There's been a lot of restructurings and bankruptcies pre-pandemic on the rural hospital side, because census levels have dramatically decreased. Doctors and nurses, there's a huge shortage, so they were very dependent on that. Nursing homes for sure were dependent, because, as Nancy said, census levels just tanked during COVID. So without the higher reimbursement levels, all of the rural hospitals and the skilled nursing facilities would have closed.
Oh,
There's
my
no
goodness.
question.
Oh, my goodness.
Yeah, and
So
the
this is-
hospitals, for that matter, their reimbursements, on the other hand, are less in COVID because COVID patients have a longer length of stay in the hospitals. And they're not, the elective surgeries ended. So the orthopedic, the higher priced and higher paid surgeries of arms, knees, shoulders, that all ended. So we were dealing with respiratory. That's what the hospitals were dealing with. And it wasn't 2 or 3 day surgeries. They had to wait till airways improved and people were able to go home. You hear stories of people that were in skilled nursing facilities or hospitals for over 300 days, induced comas. So many different things like that are very common.
Listen, tell you what, let's turn to a final topic, and that is what happens next. You all have laid out a picture for me where large segments, if not most of our healthcare delivery systems, have been dependent upon or more dependent upon the government as a result of the pandemic. But what's going to happen when, God willing, not too long from now, we read in our morning newspapers that infections have dwindled to practically nothing and there are few hospitalizations? What's going to happen then to the various segments of the healthcare industry?
I think the expectation is you're going to start seeing the segments that were struggling pre-pandemic struggle again. So, I mean, even recently, the government just approved another stimulus package for the industry. And so those monies will continue to prop up the industry, improving cash flow, but ultimately that money is going to run out. Some of it's going to have to be repaid. And so while healthcare restructurings and bankruptcy cases generally have been on the low side, at some point, and smarter people will know when, but I've heard at some point, possibly, next year, you'll start seeing an increase in healthcare restructurings as the stimulus funds run out, and as the repayments of some of those monies continue to increase.
Yeah.
Well,
I think
excuse me, go ahead, Susie.
No. I think as Nancy said, the repayments of the stimulus funds are going to be really crazy because all of the facilities are going to have to account for every single penny that they received during the stimulus that was COVID related. And so right now the facilities are really doing everything they can, hospitals as well as, long-term care facilities, to look at every single penny that was spent during the pandemic and making sure that that's reported to the government.
Oh my goodness. You all then have painted a picture for me of what could be a scary situation some number of months from now. And if it's a continuation of what it was pre-pandemic, I'm really worried about whether we're going to have adequate medical care facilities, especially in rural areas in this country, because community hospitals in smaller areas have just been decimated, or at least they were before the pandemic. Am I too pessimistic about what post-pandemic might mean for small rural areas and healthcare?
I think you're very accurate. And I think what's going on now is you're seeing a lot of mergers. You're seeing a lot of larger institutions gobbling up the smaller institutions. There's not going to be any more mom and pops because our supply chain has killed them as well. The expenses, the staffing, they just can't make it anymore. So
I would say the regulation too. It's just hard.
Yeah, the government now has become definitely more highly regulated, and they're coming out post-pandemic, and the penalties, the interest. Nancy's right.
And I think for the rural areas, I mean, it's been hard. It was hard pre-pandemic. It'll continue to be hard to recruit, the necessary physicians and other staff to provide healthcare services in the rural areas, but there has been a significant increase. This is way above my pay grade, but a significant increase in technology and in the investment in technology in the industry. Very simple example is just telehealth. Sometimes maybe even using a Zoom-like program to be able to meet with a physician if you're in a rural area and the physician's in a metropolitan area. So I think technology is going to be used more and more over time, and there is a ton of money being poured into different products. I mean, Apple Watches, everything else, to come up with different programs to make healthcare more accessible if you can't get into the hospital for treatment.
Nancy and Susie, thank you very much for your enlightening analysis and your thoughts about healthcare in the age of COVID. We could talk about the industry for hours, but you can see Nancy, Susie, and others at the upcoming healthcare program to be held on October 25 through the 26th. Thanks for tuning in. The Industry Viewpoint series in upcoming days and weeks will have other experts talking about the future of industries that are affected by our turbulent economic times. Until then, be well and stay safe. Good day.